Good afternoon, it's Kirsty here, Kirsty Wales Massage Therapies, based down in West Sussex, and today's Friday. Picture is a giveaway. I am at the Olive Tree Cancer Support Group based in the grounds of Crawley Hospital, and we help people and their families with cancer going through their journeys and their treatments to help them feel better, whether that's through complementary therapy like I do with Oncology massage, which is changing traditional massage therapies and techniques to adapt them so that people with treatment, going through treatment, can still have hands-on therapy to alleviate aches, pains, niggles, the side effects of the treatments that they're going through, some of the side effects of the medications that they're on, because they can be quite strong and cause muscular aches and joint pain. So it's really great to be involved in this place. It's absolutely awesome. And apart from what I do, I'm here every Friday. I normally see 3 clients in the morning. I've just finished for the day, and we have massage, aromatherapies, we have acupuncturists, reflexologists, counselling, music sessions. We had yoga in the garden this morning. The weather's beautiful today, so they were doing the yoga outside. So we have movement classes, we have virtually everything for mind, body and soul to help these people feel a bit better. And library full of books, loads of information. So if you're in the area, do come and meet us. Give us a call first, and then just make an appointment, pop down, and you'll be amazed at all the things that they offer in this wonderful place. So I'm just looking at my hair, it's all a bit flat because I just take my hairband off after finishing. These are great if you are still wearing masks in this warm weather, because they have buttons either side, so you can hook your mask over your buttons rather than your ears when you get them the right way round, and it keeps your hair back as well. And then you can just hook over the button there, and it's really comfy. You know, the elastic's not digging into your ears, you can adjust them. I've got a couple of knots in here to get it to the right tension, and then they're easy to take off and ever so easy to wash. So I was just admiring my headband hair. So yes, that also reminds me that obviously nothing has changed as far as therapies go, and the easing of restrictions this week. Therapists will still be wearing masks, will still be sanitising, changing the sheets on the beds between patients, cleaning all the room down, cleaning the bed, to keep everything to an absolute minimal risk of cross-contamination through contact and through breathing. So don't be surprised if you still see all the therapists wearing their masks, which is totally appropriate for us, especially in a cancer-based area. These people are vulnerable, their immune systems are struggling with everything that they're going through, and the last thing that we want to do is to give them anything else to deal with. Outside of the Olive Tree, I'm a mobile therapist, and I travel around West Sussex helping people to deal with their aches and pains. I see cancer patients privately, a lot of lymphatic drainage, which is where there's a build-up of fluid in the body, and I am still following the same protocols. They've been handed down from all the awarding bodies, and the professional associations are all advising us as close contact services to still maintain the protocols that we've been doing for the past year. So they are still in place in my practice. As a client, I still ask you, if possible, for you to wear a mask. I'll be wearing the mask the whole time, and if it's suitable for you to do so, then it would be great if you could do that. And then after the treatment, as we've been doing for the last few months, open the doors and windows, plenty of ventilation, and then just wipe down any surfaces. And that's it. So what else have I got to tell you about today? Lymph Touch. Lymph Touch is going really well, having some amazing results with it. My little bag of secret weapon, which basically works through suction, or negative pressure as we call it. So the suction cup goes onto the skin, it lifts the fibres very gently and then pulses down. So it lifts and relaxes, lifts and relaxes. And what it's doing is opening up the capillaries and nodes in the areas so that more fluid, more metabolic waste, which is a byproduct, more of that can exit and more good blood supply can come through to the area. The tissues don't get so stuck down because of the lifting, and then you get the blood flow coming through. So it's really good for getting rid of swelling from maybe an ankle sprain or a sporting injury. I had a gardener this week and her ankle blows up at the end of the day, especially in this heat. So we did a little treatment for her, and within 20 minutes the swelling had virtually gone completely and it wasn't there the next morning. So it is a little pocket secret weapon, very good on swellings, post-operatively, sporting injuries, and also for lymphatic drainage, because it opens those capillaries, which allows more excess fluid to exit into the system, which is then dispersed, recycled through the kidneys, through the liver, and then it's excreted out of the body. So it's having very, very good results about that. So if you want to know any more, please just message me, and there will be videos and more information coming onto the website. So top tips, I've been doing those all week about the heat, making sure you're hydrated and that you are keeping yourself as cool as possible. Put your socks in the fridge, that was a top tip, because your feet, if you can cool your feet down, you'll cool your overall body temperature quite quickly and bring it back to a more comfortable level. So that's why put your socks in the fridge or fill up a hot water bottle with cold water and keep that around. I've been looking at this leaflet today, which is all about skin cancers, which is appropriate with the time of year. So I'm going to pop it onto my website. This side tells you about the two main types of skin cancers that you get. And on the back, there's a really good guide. Which way do I need to go? I need to go that way. And it's got little pictures to show you what you should look for. So this skin cancer is not the type that's related to freckles, the melanoma and non-melanoma. Non-melanoma is the most common cause, and it comes from the UV rays from the sun. So it's just a little guide to tell you what to look for and help you to avoid it in the first place. And the best way is to use your SPF, whether that's 15 or whether it's 30, and just protect yourself from the sun. If you have got caught in the sun and you're a little bit red or maybe a little bit pink, then you really need to treat it like a burn. You want to cool the area as much as you can. A damp towel will help to bring the temperature in those tissues down, and just look after yourself. Sunburn is not very pleasant, and it can be quite nasty in some people. So prevention is better than cure when it comes to that. So what else? This week I have been accepted into a new professional body. I'm already a member of the Complementary Health Professionals organisation, and also the CNHC, and I can never get it right, the Complementary and Natural Health Care Council. And these associations work tirelessly for us as therapists to improve industry regulations, to get us seen. They did a lot of work for us last year with Parliament and the politicians, so that we can help people. There were certain stipulations that we could actually do a little bit of hands-on therapy or take it onto a Zoom call. So they provide training for us to keep the standards up, and they really do support us as therapists. So the new one is now the Scottish Massage Therapists Organisation, the SMTO. And as you all know, I have very strong links with Scotland. I used to live up there, and I will be looking to move back up there in the future. And that's why I'm always going on holiday or a working holiday up there. So I see people, I treat people when I'm up there. And so it's a good idea to be on board with the Scottish side of things, because they have slightly different, they've had a lot of different COVID restrictions and dates compared to England. So it's really good for me as a therapist to keep up to date with everything that's going on. So that's really exciting this week. And next week, more clients to see. I've got to put things on the website about the Lymph Touch and get the videos out to you so that you can understand it better. and just travel around making people feel better than they do when I get there. That's my mission. So I think that's it from the olive tree today. I'll be back next Friday. I'll be on and off during the week with some more tips for you. But in the meantime, have a fantastic weekend. Look after yourselves if you are in the sun. And I will speak to you very soon. Any comments, obviously, I'll come back and answer them later on, or you can message me at any time. So take care, guys, and I'll speak to you soon. Bye.